So the hamstring question I have seen quite often in physical therapy treating patients, and my gut instinct is when I see a patient who's had a nagging hamstring injury, and it's a month or two, or a recurring hamstring injury that just never seems to get better with PT, or they've gone to PT before and it hasn't helped. A lot of times I'm looking at their back, because if there is a dysfunction going on in their low back, and they're getting some like sciatica or some other nerve entrapment, a lot of times that can really mimic hamstring pain, and a lot of times that gets missed in physical therapy, unfortunately. So I'll see patients who've been told they have a hamstring strain, and it's a chronic hamstring strain for years, months, whatever. And really, what ends up happening is I have to look at their back and their low back and really treat that first. And see if I can get their back moving better and get that nerve, if that's getting stuck, if it's an issue of the nerve not gliding well, or if it's really just some sciatica, or if that nerve is really inhibiting that hamstring muscle from firing appropriately. A lot of times that's really the culprit behind these chronic or nagging hamstring injuries. So I would have someone really assess your low back, whether it's an orthopedic doctor or a physical therapist, or otherwise.